ABC Chief Medical Correspondent Dr. Jen Ashton is with me here in spirit, coming to us from Boston today as we track all of today's major developments. And as always, we have a look at a big number. Nearly 30 million Americans are now partially vaccinated. Government data shows some people waiting for that second dose, timely dose of either Pfizer or Moderna vaccine, while others are long overdue for their second shot. And Dr. Jen, so we're learning a lot about how COVID-19 affects different people differently. There is some evidence now about a possible relationship between the virus and a common complication of pregnancy. Tell us about it.
Yep, we're talking about the complication known as preeclampsia. So that affects anywhere up to 10 or 15% of all pregnant women, and the link between COVID-19. So recent study done in the UK, just published in the American Journal of Obstetrics and Gynecology, looked at women who had had COVID and then followed them and found that their risk for preeclampsia and preterm birth was greater after moderate or severe COVID-19. Those women who went on to have preeclampsia found to be 5 times more likely of having that complication if they had had severe COVID-19 compared to those who just had asymptomatic COVID-19. And there's a theory here, common features shared by both COVID and preeclampsia, that there's an effect to the blood vessels, there's inflammation, there's clotting, all of that really building this case for not just an association, but possibly causation as well.
Yeah, that's certainly alarming for anyone out there. So what should women who are pregnant, who've had COVID, do with this information?
Well, I think this is an awareness alert for both women and their healthcare providers, their obstetricians and their midwives. First of all, awareness that there possibly may be, looks like an increased risk. Screening for preeclampsia, which includes checking a woman's weight, her blood pressure, looking for signs of protein in the urine and headaches, and then prevention. Vaccination is recommended by ACOG, by the FDA and the CDC in any trimester of pregnancy. Incredibly important.
All right, Dr. Jen, we're going to be checking back in with you in just a bit. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.